Hi. How are you, friends? Bad dream is a common complaint among children. But actually, when dealing with such a complaint, and other sleep-related issues, we need to dig deep in the history to find out the right title or diagnosis for that bad dreams. The case challenge of today is related to bad dreams. We are going to discuss all the possible differential diagnosis related to that complaint to reach to the right diagnosis and subsequently give the parents the right advice. A 5-year-old boy presents with an 8-month history of inconsolable screaming 3 to 4 times per week. The father states that after falling asleep his son will typically awaken 1 to 2 hours later, screaming at the top of his lungs and sweating. He is inconsolable and terrified. He does not remember what happens the following morning. I think that it is a straightforward case. But remember to train yourself to recall and keep in mind all possible differential diagnoses possible, not to miss anything. Always try not to jump to final diagnosis without asking yourself, is it possible to be something else? I think this case most probably will be sleep terror. A sleep terror is a parasomnia characterized by nighttime awakening in an agitated state from non-REM sleep. The events correspond to prominent slow-wave sleep. Sleep terrors are associated with intense autonomic nervous system manifestations such as dilated pupils, diaphoresis, tachypnea, and tachycardia. After the event, the child is not consolable, but returns to sleep after a few minutes. In the morning, the child has no recollection of the event. It is estimated that up to 6.5% of children experience night terrors, which are most common between 2 and 6 years of age. Sleep terrors can be precipitated by stress, sleep deprivation, anxiety, and environmental noises. Nightmare. In contrast, a nightmare is a frightening dream that awakes a child. Nightmares occur during REM sleep. The child is consolable after the event and may also have a recollection of the event in the morning. While night terrors occur in younger children, nightmares are more common in school-age children and adolescents. The occurrence is normal and management is counseling and reassurance. Remember the rule. Dreams that you see during REM sleep, you can remember it. And if occurred during non-REM sleep phase, you will not remember it. At the end, remember that night terrors and nightmares do not require referral to a mental health professional or a neurologist. And there is no reported association with seizure disorders. See you next challenge. Bye.